So yesterday we discussed that we'll review some more images related to spine, and we can see all cervical vertebra numbered from 1 to 7. This is C1, this is anterior arch of C1, and this is posterior arch of C1. We can see odontide process marked here, and this is atlanto-occipital joint here, and this is the spinous process of C2. Then we can see bodies of vertebra C2, C3, C4, and we can also see facet joints. So this is the superior articular facet, inferior articular facet of C3, and this is superior articular facet of C4. So they make a vertebral joint. And then this is inferior articular facet of C4 and superior articular facet of C5, and they make joint. And the articular surface is quite horizontal. So these are the spinous processes, and we can see that the spinous process of C7 is quite large, and it has a rounded tip, and this is called vertebra prominence. This is the first vertebra spinous process which is palpable posteriorly, and this is important landmark in surface marking. Why we can't palpate other spinous processes? Because they are covered by ligamentum nuchae, that is the thickened part of thickened interspinous ligament. So this is again same X-ray, and we can see, to check the alignment we have to see different lines. There is anterior vertebral line that passes along the anterior margin of vertebral bodies, and then there is posterior vertebral line that passes along the posterior margins of vertebral body, and then there is spinolaminar line that passes along the posterior margin of spinal canal, and then there is interspinous line. So we can see that all these lines are quite aligned and parallel, so there is no significant subluxation or displacement of vertebra, and if there is subluxation or displacement of vertebra, then these lines they will not be aligned. Along with these lines alignment, any fracture, any compression of body, we can also see soft tissue signs, like this one is shadow of pharynx. We can see soft tissue changes if there is fracture, and there is none visible in this X-ray. So this is the thoracic spine, and we can see the articular surface on vertebra for articulation of rib. So this is hemifacet, called hemifacet or demifacet, and the rib articulates with the demifacets of two adjacent vertebra. So rib articulates with the superior articular facet of same number vertebra. So this is T7, then the rib attached to the superior articular facet will also be T7. But the T7 will also articulate with the inferior articular facet of T6 vertebra. And then ribs also articulate with this facet, which is on transverse process. This is called costotransverse joint, and the tubercle of rib articulates here, and tubercle of rib is located at the junction of neck and body. So this is head of rib. It articulates with two vertebra, then neck, then tubercle, and tubercle articulates with the transverse process. And we can see same diagram here, that rib is articulating with two vertebra, and this is anterior longitudinal ligament that's located on the anterior surface of vertebral bodies. And this is diagram of thoracolumbar spine, we can see there is articular facet for a rib and there is articular facet on transverse process, but we can see in these vertebra there is no lower articular facet, no inferior articular facet, because this is T10, 11 and 12th vertebra, and T10th, 11th and 12th vertebra, they have only one articular facet for their articulation with the head of same number rib. So T10 vertebra, T10 rib, 10th rib, T11th vertebra, 11th rib, and T12 vertebra with the 12th rib. These ribs articulate with only one vertebra. And then we can see other features which we can see here is articular facets. We can see inferior articular facet of superior vertebra and superior articular facet of lower inferior vertebra. They have anterior posterior direction. We know in thoracic vertebra they have anterior posterior direction. And then we can also see intervertebral foramen. We can see intervertebral foramen here, and the body is anterior to this foramen, body of vertebra and intervertebral disc, and this is facet joint and articular facets that are posteriorly, and the nerves and other structure they travel with in to and from vertebral canal through these foramen. Spinous process of we discussed yesterday, lower thoracic vertebra are get more horizontal and lumbar vertebra are almost horizontal. Then this is a diagram of spine. We can see that C7 is the first vertebra that is palpable posteriorly, and then spinous process below will be that of T1 vertebra, and then thoracic and lumbar vertebra, we can see intervertebral foramen in all part of spine, and the thoracic spines are they slope downwards, and even they are even longer and can cover body of two vertebra in middle part of thoracic spine. And this is again diagram of lumbar vertebra, and we can see where are the different ligaments attached. So anterior longitudinal ligament is attached on anterior to the body of vertebra all the way from sacrum and continues to the C1 and then to the occipital bone, and posterior longitudinal ligament is on the posterior surface of bodies of vertebra, and this vertebra also continues from sacrum all the way to C1 and occipital bone. And then there is a ligament that is attached on the tips of spinous process, and this is called supraspinous because it is above the spines. So supraspinous ligament, this is anterior longitudinal ligament, posterior longitudinal ligament, supraspinous ligament, and then there is a ligament between the spines of vertebra, and this ligament is called interspinous ligament. And then there is also a ligament flavum. So we'll see when we do the spinal tap. First we pass through skin, that's here, and then subcutaneous tissue, and then we pass through the supraspinous ligament, that's on the tips of spinous process. These are the tips of spinous process. Then we pass through intraspinous ligament, that's this one, and then we pass through ligament flavum. This is ligament flavum. We discussed that ligamentum flavum joins two adjacent laminas, and after ligament flavum we reach to this space which is yellow color presenting fat. This is epidural fat, and this is if we are putting epidural catheter or epidural injection, then we just stop here, and that is epidural space. After passing through ligamentum flavum, we reach to the epidural space. If we want to do spinal tap, then we have to pass through dura mater. This is dura mater and associated arachnoid, and then we reach to subarachnoid space, and we'll get CSF if we reach to the subarachnoid space. So these are different layers which we need to pass when we do an epidural catheter, or if we want to do CSF.